It's another head-to-head in which I show you two different patients with two different diagnoses that might get confused on imaging. You have to decide what the two diagnoses are. Here's patient one. We've got T2 weighted images through the sphenoid sinus, and you can see that the right sphenoid sinus is completely filled with T2 bright material. Here's patient two. Once again, the right sphenoid sinus completely filled with T2 bright material. If you were having trouble telling them apart, maybe CT will help. Here we see the sphenoid sinus completely opacified, and there are gaps in the wall of the sphenoid sinus. Here in the second patient, the sphenoid sinus is completely opacified, and there are gaps in the wall of the sphenoid sinus. Maybe not as much help as I thought. Here's the part where you pause this lecture and see if you can figure out what the two diagnoses are, and then I'll go over these two cases. This is a tough head-to-head. These really look very much alike, but there are some important clues that can help us differentiate them. One is the effect of the nearby brain. You can see enlargement of critical sulci near the area of abnormality. Something has gone wrong in the overlying brain. That suggests that this brain is being pulled in, and what we're dealing with here is an encephalocele. Let's look at patient two. Rather than any abnormalities in the underlying brain, that looks fine. What we're seeing here is a rounded configuration of the sphenoid sinus. In patient one, there's a nice geometric configuration to the sinus, but in patient two, we've started to round out. It's become more spherical than it deserves to be. That is a finding of a mucocele. Let's pause for a second and make sure that everyone understands a few definitions. A mucus retention cyst is what happens when you obstruct a single mucus gland within a sinus. It can partially fill the sinus or eventually completely fill the sinus, although usually they only partially fill the air cell. And it is a reflection of chronic inflammation in the same way that a polyp is a reflection of chronic inflammation. In fact, the two look very much alike. A mucocele is what happens when you obstruct an entire air cell, either an entire mastoid air cell or an entire paranasal sinus. That air cell always becomes completely filled. It's never partial configuration. And very importantly, there is a change in the configuration of the sinus. The pressure that it's under remodels the wall, and it becomes more spherical in configuration. It doesn't have to become a perfect sphere, but it starts to have curved boundaries and become more spherical in its configuration. A mucus retention cyst doesn't change the configuration of the sinus, but a mucocele does. And a mucocele occurs because there's complete obstruction of the outflow of mucus out of that air cell. A meningocele is herniation of meninges out of the cranial vault. It doesn't have to happen into a paranasal sinus, but in our case it's happening, and it makes for a nice comparison. If the meningocele is accompanied by brain tissue, then we call that an encephalocele. So is the CT any help? Well, it is actually. You can see that in patient one there is a solitary gap in the lateral recess of the sphenoid sinus, but the remainder of the sinus retains a normal configuration, a geographic or geometric configuration. It's not smoothed out. In patient two, it is indeed smoothed out. There is a spherical configuration to the sinus. There are multiple gaps in the periphery, and you can see that leading up to those gaps, there is a slow, tapered thinning of the wall. This wall has been remodeled all the way around, and the configuration of the air cell has become more spherical, as though it were under pressure. That is considered characteristic of a mucocele. So, What defines an encephalocele? Well, you can see in this picture the herniated brain tissue, and importantly, the brain tissue has been drawn into the defect, leaving larger sulci on the other side. Here, a more rounded configuration and some debris in the middle. That's not brain tissue, that's just debris, but the rounded configuration leading us to the diagnosis of mucocele. Mucus retention cysts, mucoceles, and meningoceles can be very confusing to distinguish. It's important to understand those terms, understand the differences in pathology, and know the clues that you can use to distinguish them on imaging.